Welcome to Say More from Boston Globe Opinion. Filling in for Shirley Leung this week, I'm Brian Bergstein, editor of the Globe's Ideas section. I'm back for another episode devoted to artificial intelligence. In these episodes, I try to get past the hype and better understand what AI will and won't do in our lives. Raise your hand if this has happened to you. A doctor says you or a loved one needs a test, or a procedure, or a medication, and you just need to wait for insurance to approve it. But then you find your coverage is denied. You can spend days, maybe weeks, on the phone with agents trying to understand why. That's not a new kind of nightmare, but it's getting worse, because now AI is in the mix, making decisions about what to approve and what to deny. And often, the reasons are unclear even to the insurance companies. Today, I'm joined by reporters Casey Ross and Bob Herman from Stat News, which is a sister publication of the Boston Globe. They were just named Pulitzer finalists for exposing how health insurance companies are using AI to wrongly deny people coverage. They're here to tell us about some of the most upsetting examples they found, which involve the nation's largest health insurance company, UnitedHealth Group, and its AI subsidiary, NaviHealth. Welcome, Casey and Bob, to Say More.
Thanks for having me on.
Thanks for having us.
So I want to start with a specific story that came out of your reporting that I think really explains what is happening. Casey, will you tell us about Frances Walter and what happened to her?
Frances Walter was an 85-year-old Wisconsin woman who suffered a fall and broke her shoulder. She was a very sick person at that point, and needed time to recover from this very severe injury. She's sent into a nursing home. She has an allergy to pain medicine, so she's still sort of maxing out the pain scales. She can't walk by herself. She can't dress herself. She can't go to the bathroom by herself. Behind the scenes of her care, her insurance company was using an algorithm to predict when she would be discharged. The algorithm predicted that she would be discharged and be ready to return home where she lived alone on day 16. And on day 17, they cut off payment for her care, even though she was still very sick. Her family ended up having to pay down their life savings in order to keep her in the nursing home and get the care that she needed. It put them in a really terrible situation.
So Frances was enrolled in a program called Medicare Advantage, right? And Bob, I'm wondering if you can go into some detail about what is Medicare Advantage, how is it different from regular Medicare, and how is that part of the story here?
When you turn 65, you have a choice. You can either enroll in traditional Medicare or you can enroll in Medicare Advantage. And there's one key distinction between the two, and that is if you enroll in Medicare Advantage, it is run by a private health insurance company, whereas traditional Medicare, it is government administered. And there are other differences between the two. For example, if you enroll in Medicare Advantage, those plans might offer extra bells and whistles like dental and vision or a gym membership, out-of-pocket caps on your costs, those types of things, stuff that entices people to enroll. But there's also major trade-offs, and those trade-offs are especially noticeable with Medicare Advantage. You might not be able to see your doctor or go to your hospital that you usually go to. And in this instance, there is a lot of what's called prior authorization, and that just means you have to run things by the insurance company before you can get a particular procedure or go to a certain facility. And that is where Frances and others across the country, that's what they ran into. These AI algorithms were being used as a way to screen to see how long they even needed care, and that it was being limited.
So to step back a little bit, I mean, many listeners are probably familiar with this whole idea that there's some issue with insurance coverage where the insurance company says no to something, or they'll say yes for sort of a limited stay in a facility, and maybe you have to go and appeal. Help us understand what is going on that's new where AI is coming into the decision process.
It makes it impossible to appeal or secure your rights when an algorithm that you don't know exists is being used to make the decision about your care. When that decision is being made by humans through an appeal process, you can find out, all right, who are those humans? What information were they using to make the decision about my care? Was that information that they were using accurate? When it's a mathematical model that's crunching all sorts of different data in a way that is very difficult for human beings to interrogate, and by the way, you don't know the algorithm is being used, it's impossible for you to fight back, to secure your rights, to make sure that that decision was accurate and based on you and not some vague generalization.
So why do the insurance companies say they're using AI in this stage of the process? What do they say is the benefit?
One big thing that Medicare Advantage plans and other insurance companies, why they use these types of processes is they want to root out wasteful care. And in some cases, that is true. Like sometimes people stay in nursing homes too long because nursing homes have an incentive to keep people longer. But really, nobody wants to be in a nursing home longer than they need to be.
So, Casey, maybe you can explain, what is the algorithm seeing? I mean, is it looking at the aggregate of, 85-year-old women who have had this injury, and deciding that, hey, the mean length of stay is 16.6 days? I mean, what is literally, as far as you can tell, as far as you're able to discern from what I understand is a somewhat opaque system, what is the determination it's making that's fundamentally different from what humans could see?
It's based on a reference data set of about 6 million patients. These are other patients who got care previously at other medical facilities. And so what the algorithm is basically doing is it's comparing you to the 6 million patients that are most like you in this reference data set, the 6 million patients. It's pulling them out. It's taking a look at what their length of stays were. It's comparing you to them, and then it's projecting based on your comparison to them, based on all kinds of different data about you, how long you're likely to need to stay in the facility. And NaviHealth and UnitedHealth were never clear with us and would never directly answer what patients were actually in that data set. How relevant was the comparison between the patient in question and the patients that the algorithm pulled out? But that's what it's doing. And then the patients were subject to that algorithmic prediction for their length of stay.
This is a theme that I keep coming to when I report on AI and when we run pieces in the ideas section of the Globe about AI, which is that one of the big problems, the big threats, not only in the future, but even now, is not the idea that AI will become too powerful, but that humans will sort of cede too much power to it. They will give it too much control over what are fundamentally, human decisions that ought to require discretion. And so I was really interested to read in your reporting that even the employees, the human employees at UnitedHealth, were upset about how many denials the algorithms were spitting out, that they felt that something was wrong here. Can you talk more about what you heard from sort of inside the company as they saw, AI increasingly make these kinds of decisions?
Employees were becoming increasingly upset and I think disillusioned working under NaviHealth and working with this algorithm, because they could see they would have to go into these facilities and look at these patients and deal with their families. And they were seeing that the patients were much, much sicker than the algorithm was projecting. They were having family members scream at them and getting in arguments, very heated arguments in the nursing home. At a certain point, they just couldn't take it. And to the point that you made initially, what do we always hear about AI and its use and the marketing of AI? We always hear that there's a human in the loop, right? So there's a human who's considering the algorithmic output, who's taking that algorithm and combining it with other evidence and thinking about, well, is the algorithm accurate or not? In this situation, the human wasn't in the loop at all. The human was underneath the thumb of the algorithm. These employees had a 1% target over their heads. If the patient's length of stay deviated from the algorithmic prediction by more than 1%, then they were subject to discipline. These employees were made to follow the algorithm. They were not given discretion. And that is what resulted in these horrible decisions for all of these patients and the harm that was caused.
Bob, tell us if you can how common you think stories are like this across health insurance broadly. I mean, do we think this is happening in other kinds of health insurance companies, other health insurance programs other than Medicare Advantage, so on?
It's a certainty that this type of artificial intelligence is being used across all health insurance. I think it's probably most pronounced in programs like Medicare Advantage because the people who enroll in Medicare Advantage they're older folks, they need more care. An insurance company is going to be able to honestly harvest more profit if they cut off more payment for care among this high utilizing group of people. They're more likely to go to a nursing home. They're more likely to go to an inpatient rehab center. But I do think this is across the country. Every health insurer in some way, shape, or form has mentioned that they're using AI for something. A lot of it is being used for things like reducing administrative costs on the back end, call centers, those types of things. But it is being used in these clinical decisions. And I think some health insurers are being a little bit more wary about promoting that, knowing that there could be backlash. They try to say, oh, we have clinicians involved always. But that is just not always the case. And even if clinicians are involved, they are not necessarily in a position to override that algorithm either.
I know you guys talk to a lot of people who are affected by these systems and the extremely arbitrary decisions they were making. Is there another family that sticks out to you that really illustrates the stakes of all this?
Yeah, I would say the Bent family, Gloria and Gary Bent in Connecticut. Gary Bent was a physics professor at the University of Connecticut, and he had a melanoma which traveled to his brain and had to have surgery to remove the tumor. And after the surgery, he was very confused, and he wasn't, cognitively intact. He had total left side paralysis. He was in very bad shape. And he was sent to a nursing home in Connecticut to recover. And before he was even evaluated by the staff, UnitedHealth care coordinators began calling his wife and saying, you need to prepare for him to go home in 2 weeks. And this came as a shock to Gloria Bent because her doctors had said he's going to need at least 6 to 8 weeks to recover. And here she has somebody from UnitedHealth saying he's going to go home in 2 weeks. He ends up getting discharged from the nursing home after something like 20 days. She had appealed numerous times to get him extra time in the nursing home successfully. But when he gets to the home, he's very sick. He's complaining of pain in his neck. He's got a throbbing headache. And when he wakes up the next day, he doesn't recognize his wife or his daughter. He has bacterial meningitis, and he ends up getting rushed back to the emergency room because he was discharged from the nursing home when that shouldn't have happened.
In your reporting on the Bent story, you came away clearly with the sense that AI had made this whole terrible, heartbreaking situation happen unnecessarily. Like it wouldn't have played out this way necessarily in the past?
Yeah, that's right. The algorithm was used to make the prediction very early on in Gary Bent's care about how long he would stay there. His wife didn't know about that algorithm. It was never explained to her. The UnitedHealth person who called her to explain that her husband would only get in a certain amount of time and she needed to prepare for that didn't talk at all about the algorithm. But it was run on him, and the decision that was ultimately made to move him out of the home was based on this algorithm. And when they appealed, they immediately got new denial notices because the algorithm had already decided he should be gone. So he should get another denial notice. And it just happened on repeat. And it's all because this algorithm is sitting behind their care and the patients don't know it's there.
More of my conversation with Casey Ross and Bob Herman after this short break. Bob, what surprised you the most about what you found in this investigation? I know you've covered the business of healthcare for quite a while, but what did you learn here that showed you something new or possibly even more disturbing about the direction the healthcare business has already been going in?
Yeah, I think anyone who's ever experienced the healthcare system understands very quickly how ruthless it can be. And when Casey and I were reporting this out, it started out as this concept and it just continually snowballed. People were being kicked out of nursing homes. Their families were being made to go through these time-consuming processes to try and keep them in the nursing home if they felt it was necessary. It was just brutal for both the patients and their families. And the fact that there was just no transparency behind it, Casey and I just kept coming back to that. They had no idea that their care was being dictated by this technology. And that's very defeating for these people because there was an assumption when they either signed up for these plans actively or they were put into them as retirees. Sometimes people weren't even aware that they were in a Medicare Advantage plan and this was happening to them. It's just, a lot of people felt duped. There's just this level of assumption that when you're in Medicare, you're going to be taken care of. And for so many families across the country, that just wasn't the case.
There's a lot of optimism right now about AI in medicine, that maybe it could help lead to new cures, that maybe doctors could use large language models, chatbots to transcribe their notes. I mean, on and on. We've heard so many optimistic stories about how AI could transform medicine. I'm wondering if you share a lot of that optimism, Casey, in general, about AI in healthcare, and whether there's a cautionary tale in your reporting here about the way it's gone wrong in the insurance context, that could be instructive for how AI might play out in other aspects of healthcare.
I do share the optimism that artificial intelligence can really improve healthcare across the country in a lot of different domains, full stop. There's tremendous potential to do good with this technology. But this is a cautionary tale about its use because it's being embedded by powerful organizations that control what care you get and when you get it. And there's a gross imbalance between their understanding and knowledge about that algorithm and yours as a patient. And you don't see insurance companies saying, you know what, I want my algorithm to be audited. I want to understand and make sure there's not bias. I want to make sure that there are not bad decisions being made. What you hear them saying is, we're doing that on our own. Don't worry about it. Just don't mandate that we actually are transparent or do the things necessary in public to show that our algorithm works and benefits patients at the end of the day. And I think that's the really big worry.
Bob, do you think the solution here really is going to come down to some aspect of how the healthcare business operates? I mean, is the problem here ultimately that healthcare is a for-profit business that is going to be incentivized to cut costs any way possible?
This is, I think, just symptomatic of the larger healthcare system where the large, powerful companies that run it, they have their priorities. And those just do not always line up with the needs and wants of patients and their families. That's part of the reason why the federal government is around. It's supposed to protect some of the people who might fall into some of the cracks. Medicare Advantage it's had its troubles for a long time now. And this is just like the newest wrinkle. So I think there are renewed calls to really rein this in. But, I think this goes far beyond for-profit, nonprofit. Like, these are actors within a system that first and foremost are looking out for their bottom line. And that's a tough thing to get around.
So I really hope our listeners will go and find these 4 stories in the series at Stat News that detailed this phenomenon. There's really remarkable reporting, very carefully reported, and very readable. I'm curious, though, what you guys are looking at next. What are the big unanswered questions you have as you look at the use of AI in the healthcare industry?
The problem at this point is there's just a giant regulatory gap facing what is a very new and rapidly advancing technology. The regulators in the federal government can't keep up with it. And that's a huge problem, because these algorithms, because of the potential for them to benefit organizations financially, are going to be used, and they're going to be used before there are any guardrails. And there just needs to be more of an effort to focus on, what these algorithms are, how they work, whether they are validated clinically to support better patient outcomes. All of that information needs to be known, and it needs to be public.
At least within health insurance, the use of AI deserves a lot more scrutiny. Whether we want to admit it or not, at some point, we're all going to be users of the healthcare system. You might have a baby, a parent might get sick, you yourself might get hospitalized. And it's very possible that this type of algorithm could be used against you. We all just have to remember that we will be in the shoes of a Francis Walter or a Gloria Bent and a Gary Bent at some point in the future. And is that really what we want?
Well, I'm glad you guys asked these really good and pointed questions. A lot of your reporting really unearths some heartbreaking stories, but I do hope and I do think some good will come of it. So thanks for joining me. Bob Herman is the business of healthcare reporter for Stat News, which is a sister publication of the Boston Globe. Casey Ross is Stat's national technology correspondent. They were finalists for the 2024 Pulitzer Prize in investigative journalism. Bob and Casey, thank you both for joining me on Say More.
Thank you, Brian. It was a real pleasure.
Thanks a lot. Really appreciate this.
Say More is a production of the Boston Globe. Today's episode was produced by Anna Kussmer. Our editor is Jim Dow. Our engineer is Uzair Ahmed. Our music is from APM Music. If you like the show, please follow us and leave us a review on Apple, on Spotify, or wherever you get your podcasts. You can email us at saymore@globe.com. I'm Brian Bergstein. Thanks for listening.